I recorded the talk that follows just before African-American George Floyd was killed by police in Minneapolis, and it feels very important now after this devastating injustice to add this short prologue as a means of further acknowledging the collective grief and trauma of centuries of systemic racism in the world. The cumulative psychological wounds for so many people of colour from historical traumatic experiences such as colonisation, genocide, slavery, dislocation and other related trauma create a further vulnerability in the face of COVID. And in a very recent Public Health England report, COVID's unequal impact on Black, Asian and minority ethnic communities has now been explained by the racism, discrimination and social and economic inequalities that increase the severity of the disease. Having been raised as a white person with the benefits of white privileged society, I have inevitably and unwittingly absorbed a racist worldview, and I wish here to express my ongoing commitment to anti-racist practice and the development of community feeling. The Covid-19 pandemic is a global, social and community-based phenomenon, yet COVID's apparent universality is impacting across society in very different ways. It does not affect everyone equally. And a major area where this inequality shows itself is in the field of mental health and the experiences of grief and trauma. So my aim in this short presentation is to focus on the importance of community and social connection in understanding and dealing with the challenges of traumatic stress and grief that so many are facing at this time. Alfred Adler had a profound and holistic understanding of society and cultural issues in the face of disadvantage, and he could be described as the first community psychologist. In 1898, Adler published The Health Manual for the Tailoring Trade. This was after he'd witnessed at first hand the endemic health problems associated with desperately poor working conditions and living conditions, and he noted that the workers were excluded from cultural advantages and untouched by regulations governing hygiene. Now, Adler's observations have a painful relevance today. It is understood that most fatalities from COVID will be amongst those with underlying illnesses such as high blood pressure, diabetes and heart or respiratory disease. And the more socially and economically disadvantaged a person is, the more likely they are to suffer from these diseases. In addition, those who've already suffered distressing experiences such as abuse, neglect, discrimination and oppression are at a higher risk of psychological harm and trauma from the COVID crisis. The lockdown quarantine conditions are potentially adding to this. The risk factors are falling most heavily on groups who are already marginalised, disadvantaged or isolated, including people from racial and ethnic minorities, people living in poverty and people living with physical disabilities and mental illness. So many of those I've been seeing in the midst of this pandemic have been experiencing acute traumatic stress. Covid-19 seen as a direct threat to life or the lives of others. This may involve vicariously witnessing trauma through media or through supporting others, or directly experiencing traumatic events by becoming ill, isolated, or experiencing the plight of close others. Frontline healthcare workers and providers of essential services have been particularly at risk of developing traumatic stress symptoms, compassion fatigue and burnout. Adler's experiences as a physician during World War I, where he was confronted with terrible physical and psychological suffering, resulted in some crucial decisions that impacted on his theory and practice. This was a determination to work towards enabling a sense of community feeling. Adler stated after the war, "It seems to me that what the world chiefly wants today is Gemeinschaftsgefühl." This is translated as community feeling and social interest, and it's a central tenet of individual psychology. This is Adler's psychology. Now, social embeddedness derives from this. And Adler said individual psychology regards and examines the individual as socially embedded. Eva Dreikurs Ferguson has captured Adler's core tenet when she writes, all human problems are basically social problems, the individual and society being inextricably linked. And she adds, the fundamental inner motivation of humans is to belong and contribute to society. So with lockdown, we have a major paradox and challenge to all that is central to our mental well-being. We're being told that for the good of community, we need to disconnect from others, stay at home and do as little as possible. Now this contradicts with what Adler described as the life tasks. He identified that to feel we belong and can contribute healthily, we need to meet the life tasks of occupation, work, friendship and intimacy. And there's also others have added spirituality and getting along with ourselves. And all these have been seriously impacted by COVID. The loss of work, loss of community activities and connection with friends, additional tensions with partners and family when living at close quarters. I mean, one painful result of that is that severe domestic abuse has increased markedly over this period. Now, Adler was a person ahead of his time. His wisdom and compassion apparent when he challenges us all with the following. He states, the honest psychologist cannot shut his, or we could say her or their, eyes to social conditions which prevent the child from becoming part of the community and feeling at home in the world. So if we open our eyes and look further at the way COVID is impacting our communities, it is clear that the pandemic is not affecting everyone equally in terms of potential traumatic experiences of grief. Robert Reich, a USA-based economist, describes how in the USA the Covid-19 pandemic is putting the deepening class divide into stark relief. And he identifies 4 new classes emerging. I believe his divisions could well be applied to many other countries. He describes first the remotes. And these are professional, managerial and technical workers, an estimated perhaps 35% of the workforce, putting in maybe long hours at laptops and collecting about the same pay as before the crisis. We may be bored, maybe anxious, but in comparison well off compared to other 3 classes. And here we have Joe. He's financially okay, able to work from home, but he is in deep grief, having lost his mother to COVID. He was not able to be with her before her death. Then we have the essentials. There are about 30% of the workers Reich identifies, and these include medical workers, home care and childcare workers, farm workers, food processors, warehouse and transit workers, drugstore employees, sanitation workers and so on, police officers, firefighters, etc. Now Roshni, a healthcare assistant who was redeployed to critical care, has found the work pressures have really become acute. She's wearing personal protective equipment, which is very uncomfortable indeed. She's under extreme pressure and the pain of seeing so many people so ill and dying. We have the unpaid, and they're an even larger group than the unemployed, whose ranks, Reich believes, could reach similar levels as in the Great Depression. Many of these jobs have been in personal services that can't be done remotely, such as retail, restaurant and hospitality work. Now, Lucas is a cleaner in a restaurant. He's on the autistic spectrum and as such has been very reliant on structure and regularity in his life. He's now lost his job and actually also lost the opportunity of being furloughed because of not been working there long enough, and is now distanced from his friends and family, and with uncertainty is acutely anxious and distressed. We have the forgotten, and this group includes everyone hidden away into places most of us don't see: rough sleepers, prisons, camps for migrant workers, farm workers, homeless shelters, nursing homes. And for many, social distancing is impossible. Those who I've met are Erica, who's 86, and she's living in sheltered residential homes since her husband died 1 year ago and her only son died in a car accident 10 years ago. She now has difficult medically explained symptoms and is extremely anxious about that. There is Dan in prison for assault and with a major early trauma history, and he had begun counselling in prison, building a good relationship with his counsellor, but this was suddenly stopped in lockdown and the use of online counselling was not permitted within prison regulations. We also have Cheryl, who's unemployed, living in a homeless hostel with severe dissociative episodes and agoraphobia with a complex history of childhood abuse. Just to clarify, all these case studies, they do represent those of those I am seeing and those of my supervisees, but of course they've been anonymised and there are no clearly identifying particulars here. Let's just have a look now at some definitions of trauma. I really like Judith Herman's definition when she describes trauma as experiences that overwhelm the ordinary systems of care that give people a sense of connection, control and meaning. And Adlerians O'Connell and Hooker describe those with post-traumatic stress as having been faced with experiences that have shattered their sense of personal identity, worth and belonging. And we also know that those experiencing traumatic stress commonly identify a sense of powerlessness and immobilization, a loss of connection and safety, and a sense of time and sequence being lost, and often numbing out or being hypervigilant. Now, it's a cruel irony that these common responses to traumatic events have a resonance with the reality of the COVID lockdown situation, as I've summarised in this table. We have the powerlessness and immobility common in trauma, and then we have the loss of our free movement in the lockdown quarantine. We have the loss of sense of connection in trauma, the sense of isolation in that frightening experience. And here, what's happening for us? We're experiencing isolation, that social and physical distancing. There is a sense for those who have experienced serious trauma that the world becomes unpredictable. And what is it for so many presently? There is uncertainty, unpredictability and anxiety. In trauma, the numbing out, as well as the opposite, the hypervigilance. And here we are, we can be both passive but also sort of looking out. Are we passing somebody too near? How are we keeping the 2 meters distance and so on? Those who have experienced trauma commonly describe a real loss of time. We know hippocampal functioning is often mightily impaired, which adds to this. And there's a sense of no end. And what is it for so many experiencing the pandemic? A loss of normal routines, days merging. What day of the week is it? The loss of safety, which is absolutely a crunch issue with trauma, for trauma, and a sense for so many right now is the world safe? Is it safe for me to leave the home? Now, whilst there is no doubt that there are some shared commonalities in response to trauma, Adler also made this crucial point that no experience is a cause of success or failure. We do not suffer, he says, from the shock of our experiences, the so-called trauma, but we make out of them just what suits our purposes. Meanings are not determined by situations, but we determine ourselves by the meanings we give to situations. Now, this offers an optimistic base that we can change just as we find new meanings, something that is at the foundation of all Adlerian therapy. I think When the purpose of symptoms is understood as safeguarding behaviour in not only psychological but also biological and social terms, a deeper appreciation of Adler's theory emerges that integrates very well with recent effective therapeutic approaches that emphasises the need first to ensure safety and stabilisation. Dan, who had been seriously physically abused as a youngster, created a private logic that determined that he was never going to let anyone get the better of him, and that rage and fighting all in his path was the way to find superiority, overcoming a deep sense of inferiority and discouragement, so he could survive in what he perceived as a totally hostile and unsafe world. So Dan experienced severe threats to physical and psychological integrity, and in Adlerian terms, he perceived it as the ultimate experience of inferiority, from which he attempted to maintain his well-being by what Adler called an oversized safeguarding component. This for Dan meant that he was continually on the alert, always assuming hostility from the world, thus safeguarding himself by attacking first. Now, looking further at traumatic responses, many clients following extreme trauma develop physical symptoms such as fibromyalgia, digestive and bowel problems, hypertension and cardiovascular disease, and other autonomic disorders are common. And through Felitti and Anders' adverse childhood experience studies, we also know that children who've experienced multiple traumas may have a greater vulnerability to these diseases in adulthood, which in turn creates a vulnerability to COVID. Adler wrote that you must not forget that the organism is a unit and that through a shock in one place, the entire organism is set to vibrate. He wrote, "Tension is communicated to the whole body through the autonomic nervous system, the vagus nerve, and endocrine variations." I mean, once again, Adler was ahead of his time when we look at so many of the traumatologists of today, where a holistic approach incorporating bodywork is central to effective therapy. Let's look now at grief. What is grief? I mean, grief is a normal response to any loss, and some generalities can be made to its possible purpose. A response to the loss of a significant attachment to a basic sense of safety and security. A wish to reconnect, and the use of distress as a way of gaining support and maybe a way of rebuilding the bond. A way to handle feelings of inferiority and then be able to adjust to a new and different relationship with the lost situation. However, we will approach our grieving in the same way that we approach any other problem to be faced in life. Through understanding a person's lifestyle, we can anticipate how any of us will deal with any kind of loss, whether minor or of great significance. We express our grief in relation to our social interest and through the way that we meet the life tasks, the occupation, friendship and intimacy. And in order to get a sense of belonging, we can devise a list of conditions or only ifs. And these can become the absolutes of our lifestyle. Now, Erica, aged 86, with a lifestyle of only if I cut off negative pain and carry on can I belong, had determinedly pushed away support and additional social services, activities and services since her husband died a year ago. And 10 years before, her only son had died in a car accident. And she was referred to me by her doctor before the lockdown, following severe medically unexplained stomach pain and major anxiety in the night. And at our sessions before lockdown, she owned her deep distress and realised her stomach was screaming out the pain of her traumatic early losses. And with lockdown, we're continuing with phone sessions. She's not able to use computer, and despite the challenge of enforced isolation, the stomach pains have reduced and she's responding more positively to support in her residential home. Now, whilst we're all unique, Adlerian Harold Mosak also identified the following. Not all suffering stems from the patient's lifestyle. Many patients with adequate lifestyles develop problems or symptoms in the face of intolerable or extreme situations, from which they cannot extricate themselves. So we can look also at the concept of collective grief. Erickson has described this as a blow to the basic tissues of social life that damages the bonds attaching people together and impairs the prevailing sense of community. Covid-19 has halted normal grieving, with family and friends of the deceased being physically separated and the grief often having to be handled alone. There is always a lonely component to grief, but now the bereaved do not have their usual social networks to rely on and may find their network is already too overwhelmed in trying to adapt to COVID life to recognise and meet the needs of the bereaved around them. Also, the lack of normal rites and rituals around death have been severely curtailed by the need for separation to prevent the spread of COVID. And in many cultures, the preparation of the body for burial and cremation often involves the family washing and the body in a shroud. And there may be rules about the timing of the funeral or distance a body can be taken. There may be special body viewing and visits to the grieving family. All these rituals, so crucial to enabling the natural flow of grief, have been lost for many. Now, Joe experienced acute traumatic stress when he heard his mother was seriously ill with COVID in her residential home, and he was not permitted to visit her or be with her when she died. Everything that would have been a natural movement for him was blocked. Every fibre of his being wished to rush to her side, yet he was immobilised through the regulations and rigorously held policies. This is a painful example of moral injury. This has been defined as the psychosocial and spiritual burden created by an act that goes against one's own or shared morals and values. Moral injury has been most frequently studied in combat veterans following deployment to war, but now it's also a common experience for healthcare workers on the front lines who may feel responsible for the death of others during the pandemic, where impossible choices need to be made about the distribution of life-sustaining equipment. This certainly was the case for Roshni, a deeply caring and empathic worker, exhausted by the intensity of the work, facing death in a manner she had never experienced before. In particular, there was a moment when she experienced an ultimate sense of helplessness as she had to stand by, witnessing a patient on the intensive care unit die because of a shortage of ventilators. She was consumed with feelings of guilt, shame and self-punishment, having recurring flashbacks to this scene. She also experienced a moral outrage about the lack of systems in place and lack of equipment. This patient should have lived. Now, Roshni, Joe, Erica, Lucas, Dan and Cheryl have all experienced very real trauma and grief. And it may seem that the pandemic can only wreak panic and havoc. However, Adler had an optimism that we are not slave to our past, but with support and positive connection we can heal. He stated that the amount of threat a person can bear without losing courage may be called psychological tolerance. This depends on social ties, and the solution is encouragement, which can strengthen the tolerance and prevent, ease or defer neurosis. So whilst it's crucial to acknowledge the impact of childhood and community adversity, along with cultural and economic advantage, the resilience of humanity is remarkable when the opportunity for positive community connection and ultimately community feeling is enabled. Adler emphasised that the potential for Gemeinschaftsgefühl is within us all and forms the foundation for mental health and, crucially, resilience. Once again, Adler was ahead of his time. The recent study of resilience in development has overturned many negative assumptions and deficit-focused models about those growing up under threat of disadvantage and adversity. The most surprising conclusion emerging from studies is the ordinariness of resilience, arising from the normal functions of our adaptational systems. There isn't time in this short presentation to address the specifics of therapy processes that support people to work through their traumatic experience and grief. However, in the face of the multiple repercussions of COVID-19 crisis, the practice of trauma-informed care is crucial here. This takes a multi-agency public health approach that includes public education and awareness, prevention and early awareness. It encourages support and treatment to the whole person rather than the focus on only treating individual symptoms or specific behaviours. And most critically, gives attention, goes beyond individuals and towards understanding the culture and community environment, an approach that resonates with Adler's holistic understanding. The US-based Substance Abuse Mental Health Service has captured the core principles of trauma-informed approach succinctly when they identify the importance of providing safety, trustworthy and collaborative approaches that includes peer support, empowerment, and crucially, a response taken with humility to address stereotypes, biases, and historical trauma. Now, following on from the table I showed earlier where I compared common responses to both trauma and COVID, I'm now adding some antidotes that include those identified in recent studies where people were asked what was helping them in their mental health during this pandemic. And you'll note once again that many resonate with Adler's core theory and practice. So we had the powerless and immobility. What do we need to do? Be encouraged to find agency, take autonomy, keep busy, take an active role in our recovery. And here's an important one: help others, find ways to volunteer even via online services and other means. The loss of connection and isolation, it's community connection and community support, collective activity and rituals. Once again, these can be done through online processes, and there have been many wonderful examples of this happening, of people setting up, whether it's for leisure and fun or whether it has serious supportive intent, but all those will add to the ease of the trauma and grief. The challenge of numbing out and hypervigilance and anxiety. We need to get in touch with our body, physical activity, use of mindfulness, meditation, and within the limits of the lockdown, quarantine, exercise, and finding some place of nature. In the UK right now, we are permitted to go out and exercise, albeit with the distancing kept in mind. The loss of sense of time and sequence. Here's a really important one. Activate sequences. Find routines, even in the simplest form of when you're going to get up in the morning, when you're going to go to bed, what activities, when you're going to do your washing. Look forward. This is a crucial thing in all trauma therapy, looking forward. What am I doing today? The planning for tomorrow. This loss of safety. We need to re-engage with ourselves and others, albeit through social media, but within a safe setting. We need to be encouraging ourselves and others, and finding new meanings after loss and trauma. This often is a long haul, but is a very crucial one in terms, and can be seen in terms of post-traumatic growth, where new growth, new meanings can be found even in the cruelest of circumstances. I think the good news is creative beings, and with appropriate support, new perceptions can be recreated all through our lifespan. It will not just be a back to normal, but finding a new normal that we've never been to before. It's an enhanced place. The French poet Paul Éluard said, "There is another world, and actually it's in this one." So here it is. It may be right in front of our noses as we step out of this painful time. Now, Arundhati Roy, the author, expresses this vividly in another way in a recent talk she gave entitled "The Pandemic is a Portal." She says, "Nothing could be worse than a return to normality. It is a portal between one world and the next. We can choose to walk through it dragging the carcasses of our prejudices and dead ideas, or walk through it lightly with little luggage, ready to imagine another world." Now, Alfred Adler's psychology offers a realistic optimism. Whilst it's crucial to acknowledge the depth of the impact of trauma and major loss and grief, The resilience of humanity is remarkable when the opportunity for positive community connection and ultimately community feeling is enabled. Adler gave us a psychology of use, not possession, and this in turn gives us hope.